My name is Pam, and I'm an admissions representative for the online MSN F&P program here at Mason. And I'm here as a resource for all of you to give information, answer questions, and kind of walk you through the admissions and application process if this is something you're already engaged in or if you're looking to open an application soon. So let's get started here. So first up here, we've got the agenda for the evening. We are, of course, going to meet our presenter, and we're going to focus on the MSN FNP program, specifically on what makes a program unique, looking at curriculum details and career outcomes as well. Towards the end of the session, we will focus on admission requirements, and there will also be a period of time for a Q&A at the very end as well. A few housekeeping items here as well that I want to review before we jump in. Feel free to use any of these features this evening. So we have, of course, a chat, which all of you have already started to use here. You can kind of drop your questions in there as they pop up. There's also a Q&A box that you can ask questions in as well. And you can, of course, raise your hand. But I would recommend just kind of saving your questions till the end because they might be addressed during the session itself. And there will be plenty of time at the end there for a Q&A portion to make sure those questions get answered as well. But please don't be shy. You can add those questions in as the session is going. Okay. Without further delay, I would like to hand over to our presenter this evening, Dr. Shanti Chang.
Hi, yes, thank you so much, Pam, and thank you everyone for joining. As Pam said, my name is Dr. Shanti Chang. I'm an associate professor in the School of Nursing here at Mason, and as of this year, I'm new to being the Mason Online Program Director and MSN Division Director. I was previously the Program Director for the DMP program at Mason, so if that's something that you also want to discuss or discuss pathways in general or pros and cons of each, I'm happy to go into that. But yeah, super excited to be with the Mason Online program specifically this year. And it's just a wonderful, wonderful, wonderful program since we've built it. I'll get into some more details of why I think so after this, but happy to be here with you guys tonight. So, we are, as I said, some details, ranked number 37 in the best Masters of Nursing Schools by the U.S. News and World Report in 2023. We have financial aid programs and lifetime access to Mason's career services, actively practicing faculty with decades of experience and curriculum informed by latest research, and the accreditation of the MSN FNP program by CCNE. We are up again for accreditation this year and expect that to go well. So our curriculum is founded on interprofessional education, collaborative core competencies, and we are the only school of nursing that sits within a college of public health as of this last year. So that's really unique and really important to us. I think at Mason, we believe in providing access to those who do not have access. And I think that that's something that rings true to a lot of us as nurses. We've seen how people are impacted by not being able to access healthcare services. And that's just really at our core here at Mason. And I can go into more details about how we do that, including our MAP clinics. I'm happy to answer any questions as it relates to that. But our faculty are very passionate, are all active in practice as nurse practitioners. We all, honestly, all of us work really hard to see patients who do not have insurance. I think that our curriculum is competitive and really tries to prepare the best nurse practitioners. And we have a 100% pass rate for the boards. So just lots of really good things happening at Mason. I think things that resonate with why we all became nurses in the first place. So what makes our program unique? We're very community focused with an evidence-based curriculum. Like I said, we do have all of our nurse practitioner faculty in practice, whether it be in community sites or in our free clinic sites at the MAP clinics. And we really just try to get to places where people don't have access. And we work hand in hand, side by side with our nurse practitioner students in that. And even if you're not local to Virginia, we've got advanced telehealth options to be able to do that with you, which is really unique and really special. We've got a presence in the majority of the homeless shelters in the Northern Virginia area, where you would work with your faculty as you're learning in the direct provision of care for them. And I think just overall, being an understanding program that's flexible, with understanding that you guys are usually navigating family and work and school. We're really, really, really responsive and can be reached easily to discuss some of these things and make plans accordingly. So, and we are accredited by CCNE. Like I said, our next accreditation cycle is up this year, but I anticipate that will go well. So just some really cool things at Mason happening with paired with opportunities for if you see something that you're like really passionate about and you want to practice and work on something, or giving access to a certain population. Just we're all very collaborative and interested in working together to better healthcare. So our curriculum is, like I said, I think it's a perfect blend of flexible but structured enough. You typically enter with a cohort that you'll stay with if you don't take any breaks. And if you need to take breaks along the way, then that's something that you and I would talk about and figure out. And you have a student success coach that you're also assigned to, that helps you register and figure all these things out, because I get it, life happens. But we do have a structured plan and pathway through the curriculum. And then, you have the people that you can talk to along the way if things happen and come up, or if you have questions or need to pause for whatever reason. But we start with theoretical and ethical foundations related to nursing, because we really think that it's foundational to have a good basis in theories and ethics as it relates to nursing. And that sets a good baseline for you to move forward from. And then, as I mentioned earlier, we're the only school of nursing in Virginia that sits within a college of public health. And part of that includes then the ability to work in an interdisciplinary team with other health professionals in public health. And in GCH 500, you actually go into that class and a lot of times are exposed to social work majors or health administration or health information technology majors, global community health majors, to work on some of these things related to public and population health. Nursing 715 is nursing informatics inquiry. I think we're all very familiar with technology at this point. We kind of don't have a choice not to be, at least to some extent, but this course really hits on where does nursing live within technology and within data analytics, within being able to address issues and come up with evidence-based plans moving forward. And then 757, nursing research and biostats, is also focused on looking at issues that we might see commonplace in practice, and how do we evaluate the evidence that is there to understand and come up with solutions for it moving forward. And within 688, we talk about the organization of nursing and healthcare delivery systems, because we need to understand that we sit within a healthcare delivery system in the United States, and how does that, compare and contrast to other systems? What are the challenges? How do we address some of these challenges? I don't think it's any secret that we probably don't have it all the way figured out yet. and this is what we hope for our Mason nurse practitioner students, that you would be a person at the table when you leave here as a graduate who is able to say, here's a problem, here's how I want to go about it, here's the evidence for that, here's my plan. We go into the level 2 core classes, which are community-oriented primary care, decision-making and farm management and practice, health assessment, both clinical and practicum, and then farm and patho. And those are all really important to establishing your care or establishing your practice as a direct care provider as an advanced practice nurse, and helps prepare you to do that. And then you get into your family nurse practitioner concentration courses, which is where you do like the didactics and the clinical for your FNP certification. And it's really case-based learning, competency-based learning. You work in small groups. You're usually partnered with or paired in a group with 6 people to 1 faculty. So it's really high touch. I mean, I know most of the faculty have text chains going with all their students of just, hey, what are you guys doing today? Any interesting ethical or clinical scenarios we want to talk about? And they meet regularly with their students. We do also have students from across all time zones. So it's not anything that we're not familiar with in terms of trying to accommodate and just, like I said, be accessible and responsive to you guys, because I think that that's probably one of the better things that Mason does is be available to our students and understand how to navigate both the need for structure, but flexibility. I think there was a slide here. Yep, here we go. So career outcomes, like I said, our FNP students are typically, I think the average really has been 100% on board pass rates, whether that was AAMP or ANCC. There's 2 boards that you can take as a nurse practitioner. It's a little bit different than the NCLEX when we all became registered nurses. But I think in general, there's just such a demand for nursing and nurse practitioners and primary care providers. And I think nurse practitioners are uniquely seated to be able to fulfill that need. And we also have that holistic point of view to be able to do it, not to toot our own horn, but better than a lot of other people. So we're just really passionate about making our graduates well prepared, like I said, to sit at that table and be in these critical roles to make the biggest impact in nursing and in healthcare in our country, as we have a lot to improve upon. A lot of our graduates do go to community health centers, primary care practices, home health organizations, urgent cares, hospitals, and residential treatment centers. I'm super proud that so many of our graduates continue to work with underserved populations and provide access to those who do not have access. So again, probably when we bring it back and we try to remind ourselves of why did I even become a nurse in the first place? There's some things here that really ring true for a lot of people. And Pam, I think I hand it back to you on this slide.
Absolutely, yeah. So before we jump in here, again, just a reminder to everyone that we have got the Q&A box going and the chat box as well. So if you do have any questions, please pop them into the box, into the chat box. And moving on here to the admission requirements, the admissions process. So it is a pretty straightforward application. We obviously need your official transcripts from your undergraduate degree, from your BSN. We do require at least a 3.0 GPA from your undergraduate degree. If you are having trouble requesting your official transcripts, you're not sure how to go about that, that's where we will step in and help you. But we can typically get a decision using your unofficials if you have them on file at home, which is always a little bit easier. And then, of course, if you are accepted, we will need your officials on file by the end of the first semester. So that's a really important piece of the packet. We also do require a copy of your resume, up-to-date professional resume, as well as 3 letters of recommendation, professional letters of recommendation. And what you will be doing with that is inputting the names and the email addresses of your recommenders into the portal, and they receive a questionnaire kind of format recommendation. So we're not expecting your traditional letters of recommendation, which can be a little bit more time consuming. So that should kind of make things a little bit easier as well. And then, of course, your personal statement, word count for that is 750 to 1,000, and the prompt for that is shared with you as part of the admissions process as well. In terms of prerequisites, you can see at the very bottom of the screen here, we do, as I mentioned, require a BSN from a regionally accredited institution with a minimum GPA requirement of a 3.0. We also do require an active US RN license, at least 1 year's work experience as an RN, and a copy of your current CPR card as well. Okay. Now, if you have any questions about these steps or start dates or any questions about the application materials, anything like that, you can reach out to your admissions advisor. If you don't know who that person is, I will be sharing the main number to the main office on our final slide here. Take a note of that, and you'll be assigned an admissions representative by speaking to our main office. And they'll be able to address any questions that you have moving forwards about application fees, start dates, things like that. So that will be shared. I'm going to actually share it just right now so we can give you guys a chance to make a note of that. Here we go. And we'll move on here, I think, to the Q&A. So let's take a little look-see. We've got Thomas with a question here. He says, I submitted the application yesterday. I thought that you said that the requirements was 2 letters of recommendation. So that is indeed correct. The minimum requirement is 2. You can definitely send off with 2 letters of recommendation. There is space for 3, and so that's kind of why we mentioned the third recommendation here. But again, we have sent off plenty of applications with 2. We do recommend that they are strong recommendations. So in some cases, an applicant maybe has come straight out their first year as an RN, maybe haven't got the recommendations that they maybe want. They want to add an additional professor in there or something like that. So 3 is there's room for a third one, but 2 is also totally fine. Okay. And I actually have a question from one of my applicants that I'm working with, Dr. Chang, if you don't mind. So she's asked me if classes are kept relatively small, what's the typical class sizes that we're seeing? And you kind of touched on this previously as well in terms of what kind of faculty-student interaction can be expected.
Yeah, so I actually went to a really great annual meeting today with the whole team, and we talked about retention and class sizes and, main points coming from lessons learned, I guess, since this program's been in existence over the last 3 years. And we've got people moving forward from one semester to the next with like 95, 96%. And that tells me, and when we look at then what was the other, 3 or 4%, whatever, like people not moving through the program as planned, it's all because they needed to take a pause, for unforeseen, family or life things, which again is not the end of the world, like not a big problem to take a break and jump back in if that's something that happens for you. This program is 7 semesters, usually from start to end once you go through. But I think that's a testament to how connected our students feel to the faculty and to the program director. And I'm happy to pop my email into the chat here directly. I'm always available to talk on Zoom or via phone about any unique situation that you have going on. Our class size for the bigger classes, like, the theory and ethics or stats or this and that, usually we try to cap it with 1 faculty to 24 students. But we're also mindful, again, of if it's a higher intensity class, like health assessment, for example, we just had 3 faculty teaching that class for about 30 people because we realized that it's really important for you guys as nurse practitioners to learn how to, perform advanced practice assessment. Luckily we're all registered nurses, so it's not like it's brand new to us, but it is a little elevated in becoming that nurse practitioner. So we're really conscious of making sure that you have the faculty and the administrative support that you need. And then, like I said, once you get into your clinical group, you're in a group of like 1 faculty to 6 students.
Fantastic. Thank you very much. And Thomas, you're absolutely fine. You can ask as many questions as you like. I will actually, after this webinar today, I'll go ahead and just make sure that the email's been sent out to you. I can just double check that for you. But you might want to check your junk folder. Sometimes they do end up in there. But you probably would have been sent a recap email about the program and then application checklist email by the sounds of it. I would just check your junk and spam, but as I say, I'll take note of your name and I'll make sure that you get that email tonight before I head out the office. Okay. And again, guys, please do make a note of the direct number on the screen here to the main office and also to our email address where you can kind of ask general questions. Typically, when you reach out, you are assigned an enrollment counselor who will support you all the way through the enrollment process. So if you haven't been assigned one just yet, typically by reaching out, you'll be assigned one automatically that way as well. So please take note of the details on the screen here. And if you have any other questions, please don't hesitate. Don't be shy.
Yeah, don't be shy. I just would really like to highlight that. I promise you, we're accessible and responsive and happy to talk about anything. And even if it's like a weird situation, like I have some people sometimes that say, I planned a trip to fill in the blank out of the country, and I need to plan for that moving ahead. How can I address that right now? That there's a lot of, like I said, blend between structure and flexibility here, because at the end of the day, we as Mason faculty are passionate about providing, I think, our world, and certainly our country with the future leaders that are well equipped to address problems moving forward. And that has to consider that we all come from different walks of life. We all have different things going on at all times. And so how can we ask you guys to do that for the people that you'll care for in the future as the leaders of the future, if we don't also provide you the same kind of structure and guidance and flexibility here in your education and training?
Yeah, and just to add to that, obviously you've got incredibly supportive faculty. You will also have, as I mentioned, your enrollment counselor, someone like me helping you during the enrollment process. But after you're accepted, you are also assigned a success coach who will be with you all the way up until graduation. So again, if life happens, if something changes to your curriculum plan or your degree plan or anything like that, you have a main point of contact. So even though you're online, you have all these different resources in your toolkit to reach out to. You're not working through it, alone. You definitely have a lot of support to reach out to should anything happen or if you have any questions and things like that.